Hi, I'm Kim. I'm going to share a little bit today about some pearls from Michael White, one of the co-founders of narrative therapy. What he noticed was that people are never passive in the face of hardship or trauma. He says people are always responding, whether children or adults. They respond and try and minimize the effects of these incidents in their life. They try and make it stop, and they try and protect others. So of course, we've come today to talk to a client about fight, flight, freeze. So we're looking at a neuroscience in a lot of the approaches. But what Michael introduced us to was this notion that there might be some very small things that even the client themselves had never really noticed that they were doing in the face of trauma. So the kind of things he started to get curious about is in the face of the bully in the playground or in the workplace. Did they completely stand still and do nothing? Or were they having thoughts that this isn't right, this isn't how I treat someone? So we bring out those stories of those thoughts, those values, those ways of living that the client holds dear. The person might say, well, I went quiet, I really did nothing, and I didn't really face up to the situation. And then we can perhaps talk about whether that's something they might even do again, because part of the response is protection. So, and then the client might say, yes, I was acting protectively, I suppose. Now, sadly, a lot of the symptoms that emerge later are based on the fact the client shut down. And so the client gets perhaps assessed with some kind of psychiatric condition. However, what Michael White is saying is let's get curious about how they responded rather than do an intervention, say, well, look, let's work on some breathing to calm you down. So he's very much looking at the identity of the person and how the person in themselves was acting in a small way, and perhaps they didn't even notice it. And they acted in such a way that they were showing their disgust or disappointment at the other person. I've got a case from a long time ago now, maybe 6 or 7 years ago, of a girl who was being abused in her home. And when that family member was there visiting the home, and whenever they had their back to her in any way in the house, she would quickly poke her tongue out and pull a face. So she did it safely, no one else saw. But on reflection, this was, she was already an adult at the time, but she was a girl when the abuse happened. Then she was able to see that actually she knew then that it wasn't right. She was powerless in a sense to actually do anything, but she was able to do these small things that showed herself that what was happening was wrong. And in fact, I do a lot of training where I deliver techniques and tools. You know, isn't that wonderful? People sign up and come to the professional development workshops because people are often hungry for new interventions. And I do a beautiful one, a narrative practice called Tree of Life. But I've got a slide at the beginning that says, beware of tools and techniques. These might calm your own anxiety so that you think you're good enough as a counsellor. And potentially when you bring an intervention into the session, you're bringing a third thing into the room. And is it really what the client wants and needs? So we've got to always think about that. And I'll give you an example, a lived example. So I'm working with a college student who straight away just said, I'm so stressed, I've got assignments due in just a few days. And, I'm very stressed. And I said, well, how many assignments have you ever done in your whole life? And was it like 3, 30, 90, So they agreed it was somewhere between 50 and 90 assignments. And I said, okay, so you've somehow got to where you are and you've got across the line in the past. And potentially in the lead up, in that last lead up, you've had this feeling in your tummy. What does that feeling in your tummy say to you? And, she said it was about, you've got to get moving, okay. what 3 things do you do in this situation in the lead up to all the assignments or study before an exam? What are the 3 things you do? And she thought, oh, what's Kim asking me? What do I do? And then she joked and said, coffee. And then she said, I talk to myself. I say, look, I'm 80% there and I can just finish it. And the other thing she said was, she tells herself, you don't have to make it perfect. So I said, okay. So are you happy with those 3 things? Or do you want me to bring an intervention in? A mindful breathing practice? Or do you want me to suggest that you get a schedule for the next few days and allocate hours? Is that what you've come to counselling for? What do you need? I hope this has been helpful.